All right, y'all, we're going to go ahead and get started. Thank you so much for everyone who's tuned in. You will also see throughout the chat that we're going to have some links posted as well as some instructions on how to present your questions to the panel. So if you see that pop up, please feel free to put your questions in the Q&A. But for now, let me just introduce myself and get this event started. As you all may know, my name is Vanessa Vassall, and I am the National Programs Director for Maternal Health and Environmental Justice for Black Millennials for Flint. And today we have a very exciting conversation about reproductive health and the COVID-19 vaccine. As you all have seen on social media and on the web, there've just been a lot of different misinformation floating around, specifically misinformation geared toward young folks, folks of reproductive age, and Black folks and brown folks and folks that just don't tend to have a lot of shine when it comes to the positive, but a whole lot of comments when it comes to the negative. And unfortunately, some of those poor outcomes that we've been seeing over the past year. So we really just wanted to have an open dialogue, not just about information, but also about concerns, about anxiety, about stress, especially for many of us. We live in states where young, healthy folks actually are not on the list to get vaccines yet. So we're still in that phase of, I'm still trying to decide when they call my name, they call my number, they call my age. Am I going to go get in that line or am I not going to go get in that line? So without further ado, I'm just going to have our wonderful guest panelists introduce themselves, talk a little bit about why they're here today. I'd also love for you all to share if you have any updates or any upcoming events or anything like that that you'd like our viewers to know about. And feel free to drop your information in the chat. And then at the end, we'll repost it for you. So whoever feels like they want to go first, and you can get off mute and turn your camera on and tell everyone a little bit about you.
Hi, everyone. My name is Candice Fraser. I am a gynecologist. I'm in New York City. I'm actually in the hospital right now because I'm on call. So if you hear any noise, I'm sorry. But I am co-founder and chief medical officer of Kiira Health. Kiira is a telemedicine platform for young women in colleges and universities. So we provide healthcare for women, not necessarily just reproductive healthcare, but mental health, primary care, and also GYN care via telemedicine, and also chat-based education, which is so important because when you're in college, it's the first time you're really adulting and you're just thrown there and things can go awry. A lot of colleges have health centers, but it's limited hours. You don't have a lot of choice in who you can see. And sometimes, especially for Black women, we feel we don't always have, a lot of women don't have that experience of seeing clinicians that they feel will completely understand them. And there's like a lot of fear in our communities in general. So a lot of people just avoid going to the doctor. So our goal and my goal is to create positive experiences for young women at this early age of adulting and give them good experience that they can take forward for the rest of their lives and get them set up even for when we talk about like reproduction and, having kids and sort of help chip away at that high maternal mortality and morbidity rate. And I'm here because, well, I'm a doctor and I take care of women. I take care of women throughout their whole life, including pregnancy. I've been working throughout this pandemic, both in the hospital and in the office, so definitely on the front lines, and was very happy to be able to get vaccinated. So I'm happy to share all the insights that I have, not like a scientist, but confident in I'm confident in the information and the people who are scientists.
I appreciate that you're on call catching babies and here with us. So we appreciate you so much. And we understand if you got to pop out, go catch a baby, do what you got to do. But for now, thank you so much again.
No
Can I call you Dr. Candice, or how do you want me to call you?
Yeah, Dr. Fraser is fine.
Dr. Fraser is fine.
Yeah.
Okay, fantastic. So we can have either Regina or Atalya, whoever wants to go next, introduce themselves.
Sure, I'll go. First of all, thanks so much for having me. This is an awesome event This conversation comes up so much that I think the more of us that are having these conversations that are casual and allow people to ask questions or just hear different perspectives is so important. So thanks for having this. My name is Regina Townsend. I am the founder of The Broken Brown Egg, which is an organization and blog that was created to bring awareness to infertility and reproductive health and reproductive justice issues in the Black community. When my husband and I were experiencing infertility at a young age, at 24, 25, we had never really thought about infertility affecting Black people. And when I was looking for information, I didn't see any Black people. And so it was important to me that we increase the conversation, because I started to realize that it was bigger than babies. It was about it's a reproductive health, a social justice, a reproductive justice issue when the information isn't balanced enough to give us all of our options and allow for informed consent. So the more that I studied, the more that I realized that it was more about our mental health, our physical health, our community, and what we can do to increase awareness and remove shame, because shame and silence kill. They kill, they keep us back, they hold us back. And so I really wanted to address that. And I am here today because this is a conversation that is coming up, as Vanessa mentioned, with young people. Outside of my work for The Broken Brown Egg, I'm also a young adult librarian. So I'm also serving college age and high school age young people, specifically of color, who come to the library because it's where they get information, but it's also where they get support. And so this is something that I'm seeing is affecting young people of color in terms of just not having information and them really wanting it and people assuming that they don't. And so I'm just really excited to be here and looking forward to the conversation.
Thank you so much. And last but not least.
You guys hear me? Hi, hello everyone. My name is Natalia Braun. I'm a senior at Mercy College. I'm also the president of Black Student Union at my institution. I work closely with all marginalized groups on my campus. I don't only focus on racial injustice, I also focus on things such as misogyny and inclusiveness. I think it's a major part of what I do. My perspective and my role today would be to bring awareness and representation to the students who feel that the health departments at their institution don't necessarily center women, specifically women of color. So I'm definitely excited for this conversation, and I hope to gain clarity for myself and the students that I attend with, and just all women in general.
Thank you so much, Atalya. And if you are from Mercy College, if you're from Howard, or you're from any other university you represented today, feel free to, or from another school. If you are from another school, please shout out your school in the chat. We appreciate it. We also know that we have several doulas here, and doulas that are also in training, and other ancestral birth workers. So if you are a doula, please put your information in the chat as well, so that folks can not only know how to connect with you to get more support, and throughout, whether it's preconception, they have questions, or if they are currently planning to become pregnant, as well as please put your city, because we got people from all over. That's why here I got the sun out, because it's only 3 o'clock, 3:41 where I am, and I know the sun's going down in some other places. So absolutely. So we are going to go ahead and get started. For those of you who have been attending some of our conversations in the past, you know that we'll start with a couple questions, but we love an organic conversation. Please put your questions in the Q&A. If they end up in the chat, we'll find them, but if they're in the Q&A, it'll be much easier for our panelists to talk about it. So let's get started. So as you all know, 2 weeks ago, March 11th, was when the WHO marked 1 year of the novel coronavirus pandemic. Can you believe we have been at home for 1 year? Since then, unfortunately, this terrible pandemic has killed over 500,000 Americans, and about 20% of them have been Black or Hispanic. So not only have our day-to-day lives changed with COVID-19, but health disparities that already existed in reproductive health have been further exacerbated. They have been worsened. So one of our ambassadors, Lamira Ray, shout out to Lamira. This whole event was actually her project. for her ambassador program. But a survey that she found on the Guttmacher Institute website reported that because of the pandemic, women have not been able to keep their regular healthcare appointments. They've had to delay or cancel their healthcare appointments for sexual and reproductive health. And of course, a lot of young women or women of all ages really have had challenges getting their birth control. So this has been, in particular, impact on Black and Brown women. And so what we really just wanted to open up with is each of you talking a little bit about your work and your experience. How has COVID-19 impacted young people's access to quality reproductive health? And Regina mentioned quality reproductive health information, right? And what innovative tools and solutions do you recommend that young folks or all folks addressing their reproductive health can embrace moving forward? So is there any, I know that's a long question, but is there anyone that wants to get started kind of talking about how reproductive health has changed? Go ahead.
Yeah. So, I mean, it definitely changed. I think it's thankfully, well, depends on where everyone is, right? In New York, things are getting a little bit more open, but in the beginning, when things just shut down, it just shut down. And, you know, as we were expecting surges and, you know, increasing hospital capacity, you know, not only for safety and social distancing and keeping everyone safe, but also clinicians had to be diverted to, you know, more inpatient hospital situations. So there was just a lack of outpatients, a regular doctor's office, you know, visits. So it definitely, when I'm seeing patients now, it's almost like when when was your last pap smear? Like last year. I'm like, which last year? 2019 or 2020? Because 20 was like, which one of the last years? Because it's just kind of like, oh, okay. So it's like this year just like disappeared. And so a lot of things definitely got missed. I mean, from the medical standpoint, so when we think about women's like health in the office, we think about pap smears, you know, screening, things like that. There were like new guidelines that were released by even like the cervical cancer screening and things like that. Okay, if someone, you know, because people need follow-ups for things if something is abnormal. Okay, you can push it to this extent. You can put it. So we did on the back end, the people were coming up with guidelines and telling us, okay, even when you were like limiting people in your office, like how far can you delay them? Is this really an emergency? And things like that. But I think in the Black and Brown community where women already kind of stay away a lot and sometimes show up when it's an emergency, it's kind of even pushes it even more so, where it's kind of like those emergencies, it's like you're seeing people showing up like, yeah, I've been bleeding for 5 months. And you're like, what? You know, it's kind of like so it's been harder. And also, for doctors and offices, and especially like smaller clinics and stuff, a lot of offices have closed, not just because of, you know, working elsewhere. It's just they financially had to close. So I've had a lot of patients show up and they're like, my doctor disappeared. And it's kind of like people can't, you know, find their doctors anymore. And so it's been a lot. It's been difficult in general for continuity of care. A lot of people are starting over. A lot of things were missed, because even if someone had what they would go to the emergency room for in 2019, they were not going to the emergency room in 2020. Like, where did all those heart attacks go, right? Everybody was all of a sudden healthy in 2020. So that was difficult. Birth control, things like that, you're right, were difficult. There are, even prior to this, there were a lot of women's health apps that cater just to birth control, even, televisits, and you can have a consultation, and things like that. So if you were savvy enough to look up those things and realize those things were available, you may have been able to do so. But there were a lot of people who just had gaps in their contraception. I know in New York, the governor had to state that, things like abortion care is not like elective. Those things you have to find a way, and they had to make accommodations for things that you would have to do in the office so that it would get done, over video and things like that. So it definitely created a barrier. And I think it took a while for some people to kind of figure out what was out there, because even the urgent care, there were lines, and it was just difficult to get care. So thankfully, telemedicine was always there. It just was hard for people to be like, no, I just want to come into the office, right? But thankfully now, legislation is important, and those things were put in place temporarily, where insurance companies would have to cover, like pay for video visits the same way as office visits. That was previously, and for some extent still a barrier. So those things are increased. People just have to know how to access that. There are lots of women's health apps out there. And in terms of education, Kiira, one of our founding principles is sort of like eliminating, people's reliance on Dr. Google, right? And so part of our platform is this chat, like, so you're speaking with a health expert. So, ask a question and someone real who has information will be able to give you educate you well. So I think we have to, those of us that participate and have the opportunity to know these things need to share it. Women do not share. We don't share information. We don't talk about things. Every time I have to talk someone off a ledge for, like, say, HPV, I'm like, if you survey your friends, 8 out of 10 of them have had an abnormal pap smear. They just didn't tell you, right? So we don't share these things. We share the crazy things, but not so, like, a good app, something that works for you, like, share it, put it on your social media, share it in your groups. There are a lot of things that are out there. So I am confident that, we're coming into the 21st century with technology, and hopefully, those things, in terms of not just us, the message going out, but also, legislation will continue to support us, because we're such a mobile community. Like, things aren't going to go back to what it was regardless. So I think we're going in the right direction. And yeah, just share the information. If you find something good, tell somebody.
I love Dr. Candice Fraser, because that is exactly what I was going to say. I think that sharing piece is huge, because there have been a lot of barriers that have come up. For instance, stepping out of what I do for the Broken Brown Egg, just what I do in terms of the library. One of the things that I offer in our young adult space is a comfort cabinet that has free access to tampons, free access to pads, things like that. Well, right now, if the library is closed, or if we have limited hours or services, those people who are relying on that can't access it. So in terms of telling people, hey, this place has a little free pantry outside where these things are available. Or if you're on a campus and you can work to create something like that, those kind of things are pivotal, because when we are talking about, access to care, sometimes it's just as simple as putting something outside that used to be inside. Making something available that people can't get to right now. And one of the other things in terms of the Broken Brown Egg that I was hearing a lot of was things similar to what Dr. Fraser mentioned, where things that are dire are being looked at as elective. And so when you're looking at something like, your periods are crazy, or things like that, so often, especially Black women, myself included, when I was first dealing with this, we're told that period problems are normal. It's your period. It might be irregular. It might be this. When if it's lasting for an extended amount of time, that's an indicator that something is wrong. Or when the pain is to a certain degree, that's an indicator that something is wrong. But again, because we're not talking about things like endometriosis, fibroids, we have a lot of people who just felt like, well, this is something that I can just sit with until the doctor's office is back open, or I can wait until, and the other thing that Dr. Fraser mentioned that's so on point is we don't want to go anyway. We don't want to go anyway. We don't want to go in there anyway. So if you've given us barriers, then it's like, okay, well, never mind. I get it when I get it. And that is detrimental, because so many issues could be addressed sooner if we get in sooner. And then in terms of losing access to your doctor, everything she said was amazing, because losing access to your doctor is another big thing, because since Black people and Brown people already have a valid mistrust of the medical community, it takes us a while to get a healthcare provider that we actually like and who we feel like heard us, or who's not just treating us like a stereotype or a number. So and in many cases, the clinics and things that are more devoted to that are the ones that are small startups that don't have the budget of larger facilities. So when something like a pandemic hits, they didn't have the budget to sustain themselves. And so now you've worked to find a clinic that heard you, respected you, gave you information, treated you like you were a teammate in your healthcare, and now they're gone. And now you're back to square one. And it is difficult for us to find doctors who look like us and doctors who listen to us. And so we just don't go. And that has been a big issue. So I think the more that we are educating one another about how to find a doctor, how to ask doctors questions, how to ask for a second opinion if you don't agree, basically empowering people, that will encourage people to go back into the doctor. And then that self-advocacy piece is also important when it comes to us going and saying, this is not elective. As they're closing services off based on what's essential and not essential, things that are considered normal, if it's abnormal to you to the point where you feel like it's affecting your quality of life, then it's essential. And giving people the encouragement and the empowerment to say that, I think is going to help provide more access to people, because that empowerment is what keeps us out sometimes. We're feeling unheard. And so we're just like, well, I'm just not going to go there. And that is harming us sometimes even more. So talking to each other, encouraging each other. And then the one other thing that I was going to add was, because we have such a distrust of the medical community and we've been, unfairly treated in a lot of ways, for a lot of us, especially college age young women, we go with a friend. And so when things changed and you couldn't have anybody with you, you couldn't have anybody in the waiting room, you couldn't have anybody go for the procedure with you, those who were suffering from extreme anxiety about medical procedures were just electing to not have them done. And so that's another area that we have to look at, is the impact of a support person for people who come from communities that are disenfranchised. Is very important, because we want someone who can help hold the medical professional accountable and who can provide support for us.
I'm like taking notes because I have little comments. I'm like, I can't wait to make all my little comments at the end. I want to know if hey Patricia, if Atalya, if you wanted to talk a little bit about the experience on college campuses when everything was closing down and folks had to go home, leave campus. What was the experience with y'all when it came to quality access to reproductive care during the pandemic?
Well, honestly, at my specific institution, I personally feel like the health department at my school has never really been, I would say, up to par with taking care of things. Me being a Black woman, obviously I go through issues and just having like a complex body. I've gone to the nursing office personally multiple times, and I've always just get a Band-Aid, or I get sent to an ER, and that happens with a constant pattern with more women of color on my campus. Like I said before, I personally feel like women of color at my school are not centered, and that's a problem. And I think that also does go back to what Ms. Regina and Dr. Fraser was explaining, is the lack of trust that is in the system. And I think that that's because of things similar to the nursing department at my school. Oftentimes women of color, we go to the doctor or we go to nursing offices, and it's like either we're not believed, or it's like the things that we're told don't necessarily reflect the things that we're going through. Because not that Black health is different than other health, but there is a history to things that we face as far as disparities. We have higher rates of things. Being people of color and most likely living in low income neighborhoods, everyone doesn't have access to healthcare or the privilege to go to the doctor when it is convenient. And I think that that plays a major role. And at my institution, I think that that's also reflected. Oftentimes we're just sent to the ER because they don't understand, or we can't properly explain ourselves because in our communities, we don't have this education. Things are just really different. And I feel like that's why certain things need to change. And also at my school, not that white doctors aren't as efficient, but being a Black person and a history that we have with the health, as I mentioned before, it could cause a disconnect. Sometimes it's hard to go into these nursing offices at white institutions and say, hey, this is something that I'm going through. In my culture, this is how it looks. A lot of people lack cultural competency when having these conversations, and I think that that's a major role. I hope that answered the question.
Of course it did. And I'm so glad that you said what you said, because, when I have these conversations in other circles, in fact, a conversation that Regina and I had with some of our, our colleagues that are also in the community of empowering young women in college campuses, it's a surprise to people that there are colleges with no health center. Like, it's a surprise. They're like, what? You're paying all this tuition and you can't even get taken care of? No, it's a real thing. There are, and of course it's for all students, but when we're specifically talking about this age group, this 18 to 23, 24, a very prime part of your reproductive health, a very prime part of laying the foundation for your whole life course of health, right? There are some folks, a lot of folks across this country that are paying all this tuition, paying all these health fees, and don't actually have access to a robust healthcare center, or they're on a campus where the health center is pretty much just facilitating the athletes. I'm gonna just keep it real. You go there and you're like, oh, this is a physical therapy place. this is I'm trying to get a passenger and you stretching your knee. Like, what's going on? And so we do have to take those type of things, into account. Is when you talk about policy, right? And we talk about like how do we not only think of policy from the big, Medicaid, but policy in my backyard, on my campus. If I'm paying for student insurance, what does that mean? If I'm staying on my parents' insurance, what does that mean when it comes to me going out of network, right? I'm going to school across the country. Who can I see? How can I see an OBGYN like me? Or if I'm a freshman or a sophomore, I don't have a car. How do I get to that person? So when we think about access, I think there's a lot more complex layers to just, is it available? Like, available and accessibility, are not the same thing, right?
And are they reaching out to me? Because in a lot of for a lot of us, we don't have the same experience of going to the doctor as a young person and having a voice. So when you're on a campus by yourself for the first time, you don't know where to go. And when you do go, you don't know what to ask or what's normal or what's not normal. And then, like Atalya just said, you don't know how they're going to respond to something that you say. If you feel like this person is already thinking all Black girls have some form of STD, then you feel uncomfortable mentioning something that may very well be hormonal or any other thing. So how are they even talking to you before there's an issue? How are they even giving you the information? When you get on campus, are they telling you where to go? And are they mentioning more than just STDs? Because that tends to be the case, is it's focusing on sex. And sex is not all there is to reproductive health. It's how your body works. It's not just about sex.
Yeah, I definitely agree. I feel like oftentimes when women of color go into offices and we're expressing things, usually the solution that's given to us does not necessarily correlate with what we express. I feel like a lot of the time when women of color go to these offices, it's always like, the methods are always like, okay, we can do this to prevent you getting pregnant. We can do this to prevent you from getting STD. We can do this to make sure that you're not exposed to these things. Or it's like, and I just feel like a lot of time when we go into these offices, it's like a fixed mindset, as what Ms. Regina was saying. And I just feel like that's not healthy, like, I just feel like it has to change, because as long as that's there, then like women of color would never get the proper help.
It's definitely important, you guys, what you're saying. So there are Black women doctors. There are even brown women doctors, or men. I don't know if you want a man doctor, but there are, and there might be a few culturally competent non-Black and brown doctors. But I think one of the things that people need to know is have is choice, and that's what's often lacking on college campuses, either with the hours or who's available to them and how much they can handle. And then also, our moms and our grandparents, depending on if we grew up here, they had an old white guy as a gynecologist, and that's who they take you or they tell you're going to go see. And so there are also resources for Black and brown women to look for Black and brown physicians. So look, I know there's Health in Her Hue, there's a bunch of different ones that you can, look for. So I think it's important, even though it's very valid how we feel in terms of not being heard and everything that's happened, but part of it is us taking back that control and just being like, all right, this is my health, this is my future children's health, this is my life. So we have to encourage each other to have, the onus is on us to go and find those good experiences. If you have a bad experience, or if you just feel not heard, it's not, I'm not the right doctor for everyone, right? So you go to the next person and you find those experiences, you find it, because at the end of the day, it's your body, you got to live, you got to stay alive. So we have to keep pushing. And if something is not available, and people, like, these apps were coming out of experiences, so if where you are or where there's something that's not available, especially in this pandemic, it's the perfect time to innovate, right? And create something. So that's also out there, like being Black and brown, starting businesses, innovating, creating. This is the time, because people are looking to support.
I'm glad you mentioned that, about like there is an aspect of the onus that's on us, and I know that can be very challenging, especially in a sense where you can't just expect everyone to have unlimited data, right? You can't just expect everybody to have the greatest broadband at their house, or they're in a campus that's out in the cornfield somewhere, and you're like, oh yeah, I have good Wi-Fi on campus, but not at my apartment. And so sometimes it is a bit of a struggle when we're talking about like equitable access to these things, and then we're like, everyone's individual experience is different. We're seeing that with the kids that are doing school at home, right? Like everyone's like, send them laptops, they'll be fine. And it's like, oh, it's not about them not having a laptop. It's about a whole lot of other things. And so I know that sometimes that can also be a challenge too, is just what is the infrastructure available for that individual? And to Regina's point, if you are accustomed to going in and seeing the person, like I feel like if I was going to Dr. Fraser's office right now, I'd just be like, girl, give me a hug. Like, this is going to be a great appointment, but when you don't have that, for some people, it's a bit of a barrier. So yeah, it's an equity thing, right? So yeah, go ahead.
So you're right, and I think there is a barrier, and in this country, for many different reasons, and so for those of us that can, we should, but also I wanted to say that we are aware, in terms of the healthcare community, like their American College of OBGYNs, you don't see it even sometimes as physicians, but there's a lot of lobbying. Just last week, we were speaking to our congressmen from 48 states virtually, trying to get a few, laws, or, get a few things addressed in Congress. One of them was, to prevent Medicare cuts, because that is harmful. And then also, one of the maternal mortality acts, which one of the things that it does speak about is access in rural areas. So increasing, it is known that, some areas there is no internet, there isn't good Wi-Fi, or just the same things that not everyone can, like you said, how many kids are going to use mama's cell phone to do, Zoom school, and, not everyone has unlimited and things like that. So there are people that are advocating and lobbying to try to get these things available and to improve equity. What we can do, which we don't think about, not just, yes, go out and vote, but you have a voice. And this is something I'm realizing. Write a letter, call you. You see when you get that Facebook message that says, hey, like they already wrote you the template, just click, electronically sign your name to your senator, your House representative, do that, because that's how these things get passed. They're gonna, if a bunch of people in their district is saying, hey, we need this act, we need this, they wanna get elected, reelected in 2 years or in 4 years. So again, it's the same thing. Those of us that can, we should. So it's not just like, it's hard. I know it's hard, but it's not just like, oh yeah, this sucks. Like all of this really sucks. Like, well, especially 2021, we have to get up and we have to find ways to advocate for ourselves. And part of that is voting, and part of that is engaging, not just in national elections, but midterm elections and these small elections that, because these are the people you want to get the right, these people that make laws that say, let's increase broadband, let's have places for people to have access and make this equitable. Those are the people that we need to have conversation, and you have a right to speak to those people. But majorly, I wanted to say that people are aware that these things need to be addressed, and they are actively working on legislation. But if we who are not like there lobbying can write to our officials, that's going to also carry a lot of weight. Tell them your stories. What has happened? Why you didn't get something done, or why your mom didn't get, and what happened? Like, those things are going to have a major impact.
Awesome. So I'm going to shift gears a little bit, and today we really wanted to talk about misinformation, and we want to talk about the development of facts and rumors that have been kind of floating around the internet, floating around social media. And one of the biggest ones, and one of the reasons why there's a lot of folks on the call today, is specifically around pregnancy. So as of Tuesday this week, we have 42 states and the District of Columbia, shout out to the DMV, that all have recommended that pregnant folks are on the list of folks that are eligible to get the vaccines. As you know, at the early part of the vaccine rollout, there was very limited information about the way that the vaccine impacts mom and baby. And out of Moderna, Pfizer, and Johnson & Johnson, the three primary vaccines that we have here in the United States, their initial vaccine trials didn't actually have any pregnant women in it before they were approved. And now we're hearing a little bit about some of the outcomes that Pfizer has had now that they have included pregnant women in their trials. But whether it was then, now, later, it definitely brings a lot of uncertainty about the vaccine for folks who are either currently pregnant, who want to get pregnant in the future, and of course, any of our doulas on the call today, and birth workers who work with women and birthing people who are asking them questions about whether or not it's safe to get the vaccine for them or for their baby. So first, before I ask this next question, I just want to make sure that everyone knows that this conversation is not promoting the vaccine or not. It's not telling you what to do. We're literally trying to have a conversation to get questions answered. Because I was literally in my kitchen the other day and I said to my mom, I was like, I'm about to go to Mexico and freeze my eggs. And after I come back, I will consider getting the vaccine. And I've been an epidemiologist for 11 years. I'm the last person who should be telling their mama that I'm going to Mexico to freeze my eggs, which, by the way, I'm thinking about going to Mexico to freeze my eggs. So the question is, what are the conversations being had in professional communities, in advocacy communities, in college campuses? And most importantly, what are the recommendations for pregnant people and folks who desire to be pregnant as of today, as of April 1st? The recommendations might change, but what are the recommendations so far?
So the recommendations, and so when I'm speaking from the point of view of American Congress of OBGYNs, Maternal, Fetal Medicine Society, the Reproductive Endocrinology, ASRM Society, the people who are sort of look at data and tell us like, okay, this, put it together and say, okay, this is what makes the most amount of sense. We do say that from everything that we know, the vaccine is safe. There appears not to be any, and it shouldn't, not just, I know data and seeing what happens. We always be like, I'm waiting to see what happens. Like those things, we always want to do that, except with the iPhone and the Jordans, but it's fine. I understand. But, a lot of it is sometimes is looking at the, how were these things created and the technology. And some of it we're like, oh, this is new. So like the mRNA vaccines, Pfizer and Moderna, it's new to us, but it's technology that's been in the works, that was sort of put on the shelf, when we were dealing with other, SARS and other outbreaks, and we didn't need it. And the studies, it didn't intentionally include pregnant women, but there were people who didn't know they were pregnant that got the vaccine in the studies, and also women who became pregnant while in the studies. So there was some data on effects on pregnant people, but it wasn't intentional. So we did have some limited data from that point of view, but we know from the technology and how the vaccines are created, they're not live vaccines. They don't have any live, we don't typically give live vaccines to pregnant people. They're not live vaccines. They had, no preservatives or anything that we think would be harmful. They didn't have inherent in them the potential to be harmful. Like people were concerned about changing DNA and things like that. The way the vaccine is, it didn't have the potential to like incorporate in human. It does not have the potential to incorporate in human DNA and cause any changes that we would think would harm pregnancy and or impact fertility, because it's just not the way the vaccine is made to work. And then also I want to say that when you talked about safety, it's right, risk versus benefit, right? I tell my patients all the time, there is nothing that is without risk. Drinking a cup of water, walking outside, eating that slice of pizza, going to McDonald's, drinking that glass of wine, nothing is without risk. Even when I talk about birth control, I say even pregnancy, it's not, doesn't exist. You need to know what the risks are, how to recognize any potential side effects, and then you have to decide, is this risk acceptable? So there are some people who have crazy reactions to vaccines. It's just going to happen. There are also people who can't drink a glass of water without having an allergic reaction, right? But you know what I mean? There are lots of things that some people cannot do that the rest of us can do. Sometimes we don't know who those people are until we see that reaction. Just like allergies, you don't know if a baby is allergic to milk until you're like, oh man, like what's going on? So don't be scared when you see things happening, because that's just, we're humans. It's just going to happen. But what you look at, sometimes you hear, oh, 100 people have this. Look at how out of, how many millions, right? Those are just like, they're going to happen, right? So sometimes the media, we see certain things that they promote, but they don't give us the context of it. So all of that to say that we believe that the vaccine is safe, and pregnant people should not be prevented from getting. In the very early stage, the WHO said no, and the CDC, everybody kind of was like, we don't care what the WHO says, this is what we're saying. And the WHO actually revised their statement and said, okay, because they were just trying to, CYA, as we say. But pregnant people are going to get sick. They're going to die faster. They have a higher rate, we've seen, of miscarriages, poor outcomes in pregnancy when they get infected with the coronavirus. And you don't want that to happen in pregnancy. You don't want to be in an event and you meet your baby 3 months, 5 months after the baby's born because, of COVID. As much as we can, we need to do, especially Black and brown people. We're also, just because we're Black and brown, we're more likely to end up in the ICU already. And also the benefit is we're seeing that babies of moms, not only who had COVID, but also got the vaccine, are coming with antibodies and breastfeeding. So you're also giving your baby protection. So I understand, and this is not to say that you should get it, but this is just to say that get the information. And from what we know, experts, I know lots of pregnant doctors that got the vaccine, lots and lots of pregnant doctors that got the vaccine. I've took my mom to get hers, and she's had all sorts of heart problems and surgeries and stuff like that. So I was like, yep, let's go get it. And I would give it to whoever it's available to, even if it was a kid, when they allow kids to get it. So definitely take everything, look at it the whole. You can decide not to get it, but one thing I want to encourage is when we decide not to get it, we tend to want everybody else to come on that bandwagon. Didn't you hear that? No, it's okay if you don't get it, but don't stop your grandma who's 90 years old living in the nursing home from getting it, because you know what I mean. So we can make our own decisions, but we don't have to take other people with us.
I know Regina is over here like seething. She got things to say, but can I just ask one quick little follow-up to Dr. Fraser? So for those folks, whether they are ladies, gentlemen, in between, whatever, and they have decided maybe that they don't, or they want to wait, or they're hesitant, how can they take care of their reproductive health in the meantime? What type of recommendations do you have? We know wash your hands, hand sanitizer, double mask up. But when it comes to things maybe specific to reproductive health while you're in the waiting hesitancy space around the vaccine, do you have any specific encouraging words or advice for those folks?
I mean, so the vaccine in terms of like, I mean, it keeps you, the purpose is because it's not even 100% keeping you from getting COVID, but it keeps you from dying, basically. So I think, you got to be alive to function and have, when you're thinking about reproductive health. So I think whatever you need to do, to be safe, you can't be like, I'm not getting, well, you can, but I wouldn't recommend that you're like, I'm not going to get the vaccine, but I heard the nightclub is going to open at 50% capacity and I'm going to go down there right now and party.
Yeah, that's the problem right there. That's it right there.
I can't see you on social media every month in Miami, in Mexico, in DR, in Puerto Rico, wherever there's an open airport. I can't see you doing that. Like, you need to protect those that are doing everything, protect your healthcare workers. Remember, there are also people who can't get the vaccine, right? Either they're not eligible yet, or they actually know they have problems that they can't get the vaccine. So I think we can make decisions, but also be responsible on the other side, and protect everyone around you. You don't have to get it, but then let that be reflective in every decision that you're making afterwards.
All of that twice. I've been trying to have this conversation with multiple people for the past few weeks, including my own husband yesterday. What I found is one of the biggest things is fear, and also not genuine ignorance. And that's not in the negative, like you call somebody ignorant. It's a genuine ignorance, meaning you don't understand. So when it comes to how vaccines work, there is a lot of people who don't know how they work. So when they heard there's a vaccine, their immediate thought was, we won't get sick. They didn't understand that what a vaccine does, it trains your body how to react to the illness so that if you do get sick, your body knows what to do. Doesn't mean you won't get sick. It means that when it shows up, your body is not just coming into the fight with no training. Your body now knows, okay, so you go to the left, I'm gonna go to the right. That's what the vaccines do. And the more of us who get the vaccine, eventually our bodies will know how to fight it off. And so less of us will die from this. And also less of us will transmit it eventually. Now, it doesn't mean that if you get the vaccine, you can't still transmit it. It means that eventually there will be fewer of us that have it and it won't pass as much. So I think that was the big thing, was there was a lot of people who just did not understand how vaccines work. They also didn't necessarily understand medical literacy. And that's an issue that I think is also not talked about a lot. Medical literacy actually costs the United States billions of dollars because people just don't know how to use medication, don't know how to take the medication, don't understand what doctors say to them, don't understand medical jargon. So when they're seeing terms like mRNA or ADE or just the name of pharmaceutical companies, it's scary because you don't understand it. When if you actually look into it, like Dr. Fraser mentioned, that technology has been worked on for years because this isn't the first strain of a coronavirus that we've dealt with. So it's because it reached pandemic status that they now are using it probably sooner than they had intended to, but they had been working on it all along. So to layman's eyes, it looks like they just threw that together. They just trying to get us to go back to work real quick. They didn't do no they were working on it all along, but an emergency occurred. And a lot of the misinformation has given people the false impression that this was not an emergency, when it was and is an emergency. And I think that again, in terms of that risk and you can't fight anything if you're dead. So getting the vaccine is a choice. Not getting the vaccine is a choice. Choosing to not get the information is also a choice. And I think that when we rely on a YouTube video, when we rely on a TikTok expose, and we don't do any of the backtracking, and this is my librarian showing, because people don't look into how to research. We do our papers for class and then we graduate and we like, oh, I'm glad I'm done with that. I ain't doing that no more. Life is school and learning. So you can't go through life without researching. So when you see something that you don't understand, you can't just be like, well, my cousin them said. And so my cousin sent me this video, and the dude in the video, he had a whole lot of lists of like websites that he went to. And so he really researched it. And so he wouldn't just be on here saying this. Yes, he would. And did you click on those links? And when you went to those links, did you see what that website was about? Did you look at the bottom and see if it had any disclaimers? Did you find out who wrote that information? Was it paid for? Did somebody actually research it? Is it linked to research studies? You have to know how to do these things. And if you don't know how to do these things, ask. That's why libraries exist. That's why you should have or try to find a doctor who listens and talks to you. Because if you're not understanding what it is, or if you're just having concerns about it, you should be able to call your doctor's office and say, these are my concerns. Can someone call me back and explain this to me? Because I'm trying to make an informed decision. And this, again, goes back to why this is social justice. So many things that have happened to Black and Brown people health-wise were done without our informed consent or any kind of conversation at all. So this is us taking that power back. It doesn't mean you have to get the vaccine. It doesn't mean that you have to choose not to. It does mean that you have to understand why you're doing one or the other. And like Dr. Fraser mentioned, you got to choose. Either you're going to take the vaccine and still be safe, or you're going to not take the vaccine and still work hard to be safe. You can't just be like, that's a hoax, so I'm going to do whatever I want. No, you have to also say, I don't necessarily agree, but I do see that people are suffering. So I'm going to do my part to remove the risk from me and them. I'm going to do what I want to do or choose to do or have decided to do, but I'm going to do it safely and responsibly so that I don't adversely affect somebody else. And that I'm also going to make sure that if I choose not to do something, I will make that decision with the receipts, the real receipts. And that if someone asks me, I'll give them my choice and what I've done, but I'm not going to just be on here broadcasting. Let me tell you why, because that's not how we help one another. We help one another by educating one another, supporting each other in our decisions, but educating each other. So all of that, what she said was on point, because these conversations are splitting families up right now. These conversations are getting super heated right now because those who are choosing to get the vaccine are upset at those who are choosing not, and vice versa. And we have to address the root for why we have this mistrust. And even in those things, we have to start giving each other the real information. You know, I have people who immediately throw out Tuskegee and they're like, they gave them Black men syphilis. No, they didn't. They withheld treatment from people who already had it. So even just in that, people are using things that have happened to us that they haven't even gotten the full facts on to fully perpetuate why they're not going to do something now, when actually what you're doing, if you know the facts, is you're doing what they did. You're withholding treatment from yourself. So they're coming to our neighborhoods, the lower income neighborhoods where the vaccine is available. The rich white people are coming over there to get their appointment because their neighborhood appointments are gone. So while we're debating back and forth and not educating and informing each other, they coming and taking up all the appointments. They're not trying to kill themselves. So again, you can choose to do it or not do it, but you have to have information to back up that decision. And in terms of your reproductive health, again, you want to make decisions that are going to make your body healthy. Right now, we already have a very, very bad outlook on the Black maternal mortality rates. So if there are things that are going to add to your comorbidities, that is a problem. So we need to be looking at that as something that is going to help and not necessarily just immediately react in fear. We have to look at, I don't want to die from this. What can I do to protect myself? And that may be that you're looking at elderberry or, sour stop leaf or whatever kind of, herbal remedies and things like that, that you want to build up your immune system and things like that. That's fine too. But whatever decision you choose to make, it should be responsible and thinking about beyond this moment. It has to be thinking about beyond right now. While everything is politicized and everything is heightened, that's one thing. But for me, in choosing whether or not to get the vaccine, I'm thinking about what do I want to do in the future? And how will I feel based on the decision I make today in the future? So we have to think fully about it. And it's scary conversations, but we have to think fully about it and be willing to learn and not just go off of what somebody else said they're doing or is saying.
That was fantastic. I couldn't have said it better myself. And I think that is such a perfect drops mic moment, since we are at the hour. Before we go, with Black Millennials for Flint, we always like to wrap up our events with something that we call a call to action. And so essentially everybody that is on our panel will share something that they want our viewers to do, to take action, whether it's with their health. I mean, we've kind of already said it in between with our other remarks, but if there's something or an account you want people to follow or a website you want people to check out, I actually want to start with Atalya because I know she is such an important leader at her college. If there is something coming up, an event that the Black Student Union is having, or if there's just some call of action that you want to have to give to our folks, please do it. And of course, drop your information in the chat as well. And then we'll go Dr. Fraser, and then we'll wrap up with Regina.
Well, one thing I just wanted to say, I guess, to the people that are in my age group or just in any institution, I just wanted to say, like what Ms. Regina has said, make sure you do your research, break the traditional generational that, everyone's out to kill Black people in the office, do your research, don't listen to your mother when she says put potatoes in your socks, actually go to the doctor, get some medicine. And I just want to say a call to action is if you are in any institution, definitely engage with any clubs or groups on your campuses that are focused or centering people of color. I think that it'll definitely make a big change because people are now all getting their opinions and having the chance to make change or advocate for those on their campus. I definitely appreciate Kiira and you guys so much for hosting this space. I think it was definitely needed and I learned so much. Thank you.
Yes. Yeah. Regina, you say things so much like more articulate than me. I'm always like, no. Like this is how I talk to my patients, which I think is why they come back, because I'm just like, okay, no. So yes, all of that. You're like, yes. And I'm just like, yeah, that. But anyway, I guess my call to action would be to invest in your health this year and to sort of take action. I know things are limited, but find a way. If you haven't been to a doctor, whether it's a primary care doctor, a gynecologist, whatever it is this year, find access to that. Like we said, there are ways to find someone that you feel comfortable with. At Kiira, even though we focus on colleges and universities, our app is available on the App Store for women in general to download, and we have multicultural clinicians on our platform. And find someone good, and then when you find that person good, tell someone else. Bring your friend, bring your mom. Take and then also, even if you feel like the vaccine isn't the right choice for you right now, still reach out to your mom, your grandma, and be like, hey, do you need a ride? Do you need me to look up a vaccine for you? Someone that is like ill or, might have a difficult time, getting access, figure out if there's someone else that wants to access it that's really in a high risk group, and reach out to them and let's help them, because Regina is correct. People are crossing lines and they are finding those opportunities to do it. I know we're out of time, but one more thing. One of the things people say is about the chip in the vaccine, y'all, if they wanted to microchip us, this will be the worst plan because half of us don't plan on getting the vaccine. That will just be a bad plan. Okay, so just stop saying that one. And you know how it has to go through a syringe, y'all. Stop it with that one. Anyway, that's all.
Any final thoughts, Regina? Yeah, go ahead.
I love it. First of all, I just thought this was amazing. I think it is so important that we continue to have these conversations that are unbiased. You choose what you want to do, but do it with knowledge. Don't just do it because somebody said. Actually look it up, make a choice. You can't lazy this out. You can't be lazy with your life. You got to make a choice. The two things that I will bring up, April is a big month in terms of reproductive health. So the week of the 11th is Black Maternal Health Week. So get involved, look into it, find out what activities are going on. There's tons of stuff happening online and lots of workshops and things like that are going to address all of the things that are affecting Black women in our maternal health, including postpartum, including fertility issues, including reproductive health options such as egg freezing, egg donation, sperm donation, all that kind of stuff. So look into that the week of April 11th. The week of April 18th is actually National Infertility Awareness Week. And what my hope is that we continue to give voice to Black and brown people in that space. Because when you look up fertility, you don't see us because there are stereotypes that say that we're hyperfertile, when actually we are affected by infertility at 2 times a higher rate. So those are 2 weeks that are jam-packed with activities and opportunities for advocacy. That's the big one. Advocate, advocate, advocate. We're all in this together. We all kinfolk. So we need to find more and more ways to support one another, educate one another, and advocate for each other.
And I'll wrap that up by saying April is even more things to do because it's National Minority Health Month, or I call it National Multicultural Health Month because I'm not a minority. But I also want to say Black Millennials for Flint. As you can only imagine, we got a ton of stuff going on next month. So definitely continue to follow us on IG, continue to read our newsletters, continue to check out our Facebook. We're trying to get people to subscribe to our YouTube. We're going to be doing some more stuff on there, but also as it pertains to reproductive health in general. For those of you who are planning to get pregnant or are considering it, I definitely encourage you to look for doulas in your community who can help answer all these questions. If you don't necessarily have a primary care, an obstetrician that you trust, maybe that doula can give you a recommendation of someone that they partner with. And if you have had a good experience with a doula, look into like Dr. Fraser said, legislation that will support making sure that these doulas are getting equitable compensation through Medicaid reimbursement, and most importantly, that they're actually physically able to come into the birthing space at hospitals when the time comes. They are not a guest. They are a worker, a birth worker. That is not my homegirl. That is my doula. So if I got to count mom, baby's dad, and all the other kids, no, she got to come too, with the nurses, with the midwives, with everybody else, right? So that's, y'all know I'm always plugging for my doula gang. So that's the last thing I have to say. I'm so grateful for everyone for tuning in. Thank you so much to our wonderful panel. Please check out the Kiira app. Please check out the Broken Brown Egg. If you're at Mercy College or Howard University or any other college, thank you so much for tuning in. And we hope you all have a wonderful, wonderful week. Happy April. Stay healthy, stay well, and we'll talk to you soon. Bye, y'all.